Good almost afternoon, everybody. My name is Olivia Rayner. I have the pleasure of being the director of the Tarjan Center at UCLA, and we're very pleased with your participation and involvement in our Tarjan Center lecture series. I'm going to have Dr. Laugesen introduce our speaker, Dr. Grantz, and it's obvious from the attendance today that transition is a hot topic. So we look forward to her presentation and an interesting dialogue after she's completed the formal presentation. So welcome.
All right, well, good day. I can never decide if I should say good morning or good afternoon, so maybe just good day. Well, not like an Aussie would say, but like Angelino. Well, welcome everyone. So on behalf of Dr. Olivia Rayner, our director of the Tarjan Center, which is our University Center for Excellence in Developmental Disabilities, I want to welcome you all here. This is also an event that's co-sponsored by CART, the Center for Autism Research and Treatment here at UCLA, and also the IDDRC, the Intellectual and Developmental Disabilities Research Center. So on behalf of them, I'd also like to welcome you. So it's my pleasure to introduce our distinguished speaker today, Dr. Carolyn Grants. Just a little background about Dr. Grants. She's a pediatric neuropsychologist with expertise in autism spectrum disorder and related areas of difficulty. She's originally from California, and she went to graduate school at University of Miami in Florida. She completed her internship at Rush University Medical School in Chicago and a postdoctoral fellowship at Oregon Health and Sciences University in Portland, Oregon. Throughout her education, she received specialized training in neuropsychology and is pursuing board certification as a clinical neuropsychologist. In 2016, Dr. Grants was delighted to move back to California, where she worked for 2 years at the Children's Hospital of Orange County, helping to build autism spectrum disorder assessment and treatment services in partnership with UC Irvine for their Center for Autism and Neurodevelopmental Disorders. And before she joined the faculty here at UCLA. She's an attending at the UCLA CAN Clinic, which is the Child and Adult Neurodevelopmental Clinic, and she's worked across the lifespan with individuals on the autism spectrum and their families with the goals of supporting daily functioning and helping families plan for their future. She's passionate about helping individuals on the spectrum understand themselves better, to access resources and services that are available to support their development and functioning and build full, satisfying lives. And this afternoon, she'll be presenting what I'm sure will be a really interesting and probably very useful lecture on transitions for young adults with ASD, what we know and what we need. So please join me in welcoming Dr. Grants. Thank you.
Thank you. Thank you guys all for braving LA scary weather to be here. I walk to work every day and I was just like, okay, let me just swim to work. Things are going great. So I'm going to be talking about kind of both the research and the clinical components of transition, what we know and a lot of what isn't happening yet, but I think would be really helpful to have for this population. The only conflict of interest is that I am a part of the College to Careers program, which is something that I will get into later and in no way impacts any of my conceptualization of transition. Okay, so I would assume that autism spectrum disorder is probably a fairly well understood construct or disorder, but I do think it's kind of a helpful jumping off point, so we'll start there, and then we'll start talking about the process of transition out of high school for individuals on the autism spectrum, including things that are going to impact the success or difficulties of that transition process, and then kind of get into some of the recommendations that I've talked to families about clinically and also that research programs are starting to move towards in terms of supporting this transition out of high school. So autism spectrum disorder, it's a lifelong disorder, right? So as our population of individuals with autism is aging into adulthood, that recognition that services and supports are still needed in adults with autism spectrum disorder is becoming clearer, and interest is building in that. The domains of difficulty are social communication, which can include everything from complete lack of verbal or very minimal ability to communicate verbally to very complex, well-developed verbal communication with nuanced deficits in how we are kind of reading other people and projecting our thoughts and feelings with our body as well as our language so that others can read us. These difficulties emerge early in development, but I will talk about within the young adult population, there can be kind of subtle challenges that maybe weren't noticed early on or were not applicable early on that can become more obvious as individuals age into adulthood. And there can be comorbid challenges that go along with that. Within this kind of transition into adulthood period, one of the things that we often see is that kind of expectations and settings are changing, right? So I'll get into this a lot more in terms of the structure that individuals with autism experience through school and through that kind of childhood period in terms of the treatments that they do and the schooling that they get, et cetera. All of that is changing as you think post-high school. If you think about your own experiences, my guess is, some people went straight to college, some people didn't. After college even, there were people who may have gone straight to graduate school, people who took time off. You worked, you didn't work. There's a lot of different things going on, and all of those avenues have new social expectations, new expectations for independence, new dynamic processes that are needing to be kind of engaged with that can start highlighting even really subtle challenges that weren't notable earlier on. Persistent challenges, I often will see this as well. Things that have always been difficult can become kind of increasingly frustrating for families because they've kind of hoped that the amount of intervention that they'd put into children would lead to kind of improvements beyond what they're seeing. And so that's another thing that we can kind of address is recognizing how far an individual has come and maybe more realistic expectations for their adulthood. And then what I talk about often is kind of the sequela of ASD can be these subtle learning difficulties or these subtle executive dysfunction difficulties that can become more pronounced as individuals get older. So the transition process typically starts when we think about it or talk about it at school in terms of the planning that goes into and through an individualized education program or an IEP. So often that is where families are first hearing about transition. That needs to start at the age of 16 and needs to include goals around what the child is going to do after high school. And those goals can vary widely depending on the needs of the child. Kids also need to become part of that IEP meeting at the age of 16. There's research to show that that doesn't always happen, but that is what's supposed to happen. Goals can be varied, right? So some goals are go off to college, some goals are we're gonna need really specific vocational training and placement, and remaining within a public school education until the age of 22 to support that kind of vocational rehabilitation. So again, if there's higher need, which can arise for a variety of reasons, goals can be very, very structured around what this child is going to do through the age of 22. Now, briefly, 22, they'll then turn 23, right? So they're still going to have this gap in services or this change in the amount of structure that is supporting them. It just might happen a little bit later, right? Another thing that's really important to think about clinically in working with families is that school-based transition is not going to touch on all the other domains of an individual's functioning, right? So unless every once in a while I hear about schools who are just incredible and are talking to families about these other domains, typically they're not talking about things like legal conservatorship or housing opportunities or different, kind of financial supports that the child may need. And so that can leave families feeling really stressed out that they don't, it's like, what are all the things that you think about when you worry in the middle of the night about your child? A lot of them are not being addressed with this more formal school-based transition planning, and that's something that I think about clinically a lot, is trying to support families across domains so that they're not feeling like there's anything that they're having to kind of search the wilderness for on their own. For individuals with fewer maybe intellectual struggles or stronger communication skills, this can be a time where subtle deficits again are starting to emerge. And one of the things that I find a lot of times with families is that they have kind of forgotten how much structure they're putting in to their child's life, right? And so as we transition out of high school, it can kind of be a shock when you pull away some of those supports, not realizing they were still there, how much need that child still has for things like reminders to take medication or reminders to shower or make their bed. Another thing is that these routines have been practiced for years, right? So if every day you go to school and you have these teachers that are prompting you to turn in your homework, and then you come home and your boots go in the same place every day, there might be a lot of kind of routinized prompts for what looks like independence that can be removed as you transition into college or vocational experiences. And all of that can be really challenging because the child themselves, as well as the family, can be very confused why suddenly it feels like this is not working and we thought that he was doing so well, right? So just kind of briefly to talk through more of the transition experience. Again, through high school, typically there's a pretty concrete set of experiences that an individual with autism has. So that includes an IEP typically, right, which is the school-based plan supporting their education and academic goals and attainment. Also, their pediatric providers, which can include, ABA, speech therapy, occupational therapy. They tend to know if they're working with individuals with autism spectrum disorder, other individuals with that expertise, right? So the pediatric community just kind of tends to be a little bit more knowledgeable about what other services are out there, who they would recommend. And anywhere that I've worked, I've kind of had that experience where we kind of know who else is in the community, right? And then also, kids are in school for a long time, all day, right? So in terms of kind of thinking about programming for the day, through high school, you don't need to do a ton of that as a parent because your child's in school for 6+ hours, right? So then, there's a really hilarious picture of a cliff. Just imagine a cliff. What happens after you transition out of high school at either 18 or 22 is that suddenly, it's what we've all experienced. Suddenly, you're an adult. You can do whatever you want to, right? And so this incredibly huge jump towards independent expectations can cause both a reemergence of challenges that you kind of thought you guys had made more progress on. It can cause an emergence of new challenges as the individual confronts a world that's a lot less structured than they thought and is therefore more stressful. And then again, as I said, there can be this recognition of ongoing needs where families kind of thought that they'd been making progress and that was going to lead to a level of functioning that it's now kind of becoming clear that's probably not the case. So, as I said, the school-based transitioning, it doesn't focus on all areas of an individual. And so one of the things that I'd like as kind of a takeaway clinically, as well as, in terms of anybody interested in research in this domain, is really helping families recognize all the areas that they should be thinking about. And I would say most families are already thinking about it, but really helping them understand they should be thinking about it. They're doing a really nice job if they're starting to think outside of just what's next academically, or hey, we have this IEP, we're doing great, right? Because adulthood is a lot of things, and being mindful and planning for those different domains is really essential for a successful and less rocky transition. Another thing that happens as individuals age out of public educational services is that while service acquisition for children can be very challenging, and I imagine anybody who works clinically with individuals with ASD knows that it can be very difficult to find high quality services without very long wait lists, that is exponentially more challenging as an adult, often because the services are much more limited, there's often very long wait lists, and sometimes it can require a lot of impairment to qualify, which is something that this resource cliff can be very difficult to navigate if your child has intact cognitive abilities, because some of the services that are really well established for individuals with intellectual disabilities are not available. And so families, I think, can have this experience of things are going pretty well through high school, and then suddenly they didn't really anticipate post-high school who's there, well, it's just them now, right? And my goal is that it is not just them, and that's part of why I'm so passionate about this area, but that is the experience that you've gone through this school-based program where they were tracking your child every year, and every 3 years you got updated information about their functioning, and suddenly it's like, off you go. So adult providers typically have less. There are certainly fabulous adult providers with expertise in ASD, but they are less common than pediatric providers, right? So it's harder to find them. When you do, often there's long wait lists. And in general, and this has been found to be true across medical populations as well for pediatric versus adult, something about pediatric providers creates a more of kind of this like home-based model, this like medical home model, that adult providers tend to be more fragmented, where your neurologist is there and your psychiatrist is there, and there's less of this kind of interdisciplinary engagement with adult providers. And so because of that, it can be hard for even a great provider to know who else in the community has expertise in this domain, right? Also, just in general, there are fewer with expertise in autism spectrum disorders. Another thing that can be really challenging during, the search for services is that services might not be a good fit for everybody. So again, there's some really fabulous services for individuals with intellectual disabilities that support vocational training, that support vocational placement. But if you have an individual whose functioning is well above average intellectually, they might really not fit in a program like that. It might not make sense to them. It might be way too routinized or monotonous. They will not feel like the individuals there are their peers. And so that can be really challenging to try to find services that are a fit across this very wide variety of skills and deficits that you're going to have as a young adult with autism. And then certainly the fact that your daily structure has gone from probably pretty structured and pretty expected to potentially you are now just sitting at home, or you are expected to navigate a college campus with varying, times of class, and nobody's there to push you out the door to go. All of that can cause a lot of stress and anxiety, and kind of an uptick in both ASD symptomatology, like social withdrawal, as well as just general emotional distress. So one of the things that I'll say, there is good news. There's a lot of research to show that over time in adulthood, individuals with autism spectrum disorder are getting better. We're seeing fewer mental health challenges. We're seeing a reduction in ASD symptomatology. And that makes sense from a neurodevelopmental standpoint, right? We all are continuing to develop our brains, and that is going to help us continue to integrate intervention, feedback, et cetera, to kind of build skills continuously, which, I think we all feel like we're doing better, than we were 10 years ago or whatever, right? And that is true for individuals on the spectrum as well. What's challenging and what is hard about this topic is that the outcomes really are still not very good at all. So you can see the percentage of kids in their early 20s who are experiencing pretty poor outcomes from most perspectives, right? It's really high. And I mean, in the age of a poor economy and the millennials, never living independently in your early 20s probably needs to be taken with a little bit more of a grain of salt, because I think there is kind of a changing social landscape in general. However, when we think about proxies for success, or what we want in terms of young adults launching into the world, it's troubling to see how few are getting the services and supports that we know are likely to be helpful, right? And other things I'll say is that often what we're finding for individuals with autism who are employed is that employment is not always consistently maintained, and it's often pretty low, like minimum wage-ish. They're not making a ton of money. Often it's not full-time, and if you think about the impact on that of things like benefits, right? If you're working a couple part-time jobs and you're not getting benefits through any of them, that is a very different experience than working a full-time job with benefits. There's also a lot of findings that even for individuals who did post-secondary education, so some type of college experience, they often are not working in the field that their education was in, right? And so, I think exploration still needs to happen. Was that a field that they were kind of intellectually interested in but never wanted a job in? Or is that a field that was too difficult for them to find employment in, either because it's too esoteric or it's just not easy to get jobs in that field? There's a lot of data that we still need to collect around that, but it's certainly troubling if, for anybody who's gone to graduate school, or even college, right? It's a hard process. It feels good to attain something that feels that was a goal-directed process, right? And so for that not to be the case is definitely concerning. And then there's also a lot of data to show that families continue to be the financial and social supports for their children, which in some ways is really lovely and beautiful, but if we think about caregiver burnout and the stress that can go along with having a child with an autism spectrum disorder as they age into adulthood, it's something that we need to be very mindful of. Okay, well, here's the cliff, but with a bridge. Now we're navigating it. Okay, so there are some predictors of positive outcomes. Before I get to them, though, I think one of the big questions in this field is what is a positive outcome, right? So it's defined in a couple of different ways depending on who's asking and what they're looking at. Often it's some marker of engagement in either vocational, so some type of work, or post-secondary educational experience. Often that's not defined as either full-time or even paying, but just kind of some engagement in the community around that. And then typically there is some social aspect as well. Interestingly, some studies have shown that engagement in recreational activities, which often are likely solo, so like reading or going for a walk, that is kind of a protective factor or a factor that supports a positive outcome. So not everything, that kind of hints at not everything about a positive outcome might be exactly what we might conceptualize as a positive outcome, right? And I think that would be one of the other take-homes that I'd like for you guys to have. Reconceptualizing what a positive outcome is likely to really help these young adults. Like, what do they want? And is that feasible? And how can we make it as feasible as possible to attain as close to what they want as possible? It may not be full-time employment, right? Like, not everybody who is neurotypical wants to work a 50-hour-a-week job and commute an hour and, whatever. Like, there's a lot of people who don't want to do that, right? Which is kind of a issue people have with millennials, but you know what I mean? Like, there's a lot of ways that a positive outcome can happen, and I think that that's one really important metric to be mindful of, that helping, working with young adults on the autism spectrum to see what is their positive outcome is a really important first step, because us defining what we think an optimal outcome is probably not appropriate and not going to be very useful for them if that's not what they're working towards, right? But some of the things that have predicted engagement in the community, engagement socially, and kind of engagement in positive health behaviors are IQ. Interestingly, there's kind of two types of findings around this. Individuals with lower IQ often have access to more structured adult services, and that can be very useful to families, right? And one of the stressors that I often see clinically in my young adults with high IQ is that those resources are not available to them, but their deficits are still real and they're getting in the way. And so, high IQ often is found as kind of a predictive and protective factor, because it does typically go along with stronger skills in general for being able to be more independent or being able to kind of navigate the world more easily. But there's kind of a pro and a con in terms of outcomes at this stage because of the structured supports that are available to those with lower IQs. Stronger adaptive skills are also kind of consistently found to be a predictor of positive outcome. One of the things that I'll say about this, which I think is very interesting within the world of autism spectrum disorder, is that this is not always correlated with intellectual functioning the way you might find in other populations. So there are many individuals with very high IQ with autism spectrum disorder whose adaptive skills are very challenged, right? And so I think thinking through clinically, how do we address adaptive skill deficits and really make sure that we are building up independent skills in these individuals is really essential, because that is how independence happens, right? Through being able to independently do things, and that's something that IQ alone will not confer. Also, lower symptomatology within autism spectrum disorder, and that is likely because you're going to have improved communication abilities, less restricted interest, repetitive behaviors that are taking away from your ability to engage in other things. And then obviously anything that is, any challenging behavior is likely to get in the way. So having fewer of those is a positive thing. There's also been some kind of outside of the person findings, higher family socioeconomic status and education. That likely, at least on some level, is supporting the family in figuring out how to help their child navigate. And so that is, what's interesting is we don't necessarily always find that prior to transition out of high school. And one of the thoughts is that something like an IEP, at least in theory, should not be economically dependent. And so everybody should be getting the structured supports they need. And then when that ends, you have what you would expect, that if you have higher resources, your ability to access the community is going to be improved, right? And then maternal warmth has been found to be another predictor. The opposite, I'm just going to jump to the bottom, the opposite, maternal kind of expressed negative emotion, has been found to be a predictor of negative outcomes, which again would be defined as disengagement and social withdrawal, emotional distress, et cetera. I think that this is an important thing to touch on, just because that is not saying that moms who have high levels of expressed negative emotion are causing their young adults on the spectrum to have negative outcomes. Likely what it is a transactional effect where these children are likely more difficult. And so this mom is having to navigate a more challenging situation and maybe speaking about it in a different way, right? This is not my research, it has been found, but I just always like anything that has to do with parental interactions with children. I think it's important to kind of reflect on what does that actually mean, so that we're not kind of walking away with moms feeling like they're causing something negative. So interestingly, one of the predictors of negative outcomes has been found to be gender, and it's actually females that are having poor outcomes. And one of the hypotheses is that there's stronger gender discrimination with women in the workforce, possibly because kind of inappropriate or poorly developed social skills are considered worse in women, right? That a woman with poor social skills is going to potentially be judged more harshly or kind of interpreted in a more negative way. Executive dysfunction is another domain that's really impactful for individuals on the autism spectrum. This is something that many individuals on the spectrum, if you work with them, you know that this is something that can be very challenging for them, but it really correlates with adaptive functioning, right? Because you have to plan, organize, execute these independent tasks. And so that's an area that I will revisit, I think really needs a lot of focus and intervention as we're working towards independence for these young adults. And then again, as you know, the converse of lower ASD symptomatologies, if you have higher ASD symptomatology, probably it is more difficult for you to engage with the community without more support. And then, you know, the converse of, you know, high SES is that if you have less resources, it's probably much more difficult for you to find and access the more scattered supports and services that are available for young adults. So that's kind of the bummer part, but positively, there's actually a lot that's being done to build better supports and services, A, understand them, and B, build what is needed for young adults on the spectrum. So this is definitely not an exhaustive list, but some of the things that are going on. There's a group psychoeducation intervention for parents and their adolescents that's really trying to build knowledge and skill around all the different domains to interface with and who in the community to start building partnerships with, et cetera, to help that transition be more successful. There's a lot of research on life course outcomes. There's national data being collected around school-aged kids and transitioning out of school that's then being used within the autism research community to really understand the experience of students with autism as they transition out. I don't know how familiar anybody is with Project Search, but it's a kind of a structured vocational placement and support project that has kind of been retooled for the specific needs and strengths of individuals with autism. That's been finding some success. And then we here at UCLA are also building a program to help build skills in college students to transition into the workforce. So briefly, our program is evidence-based. It's a social skills curriculum based on peers. that is really focusing on employment-related skills. And what's exciting about this is really thinking through what do we want these young adults to successfully do to not just gain, but also maintain employment, right? So thinking about interviewing skills, making sure that them coming through the door isn't an immediate no because of how they're presenting, right? Making sure that they are navigating successfully things like humor in the workplace. So having done some employer interviews, those kind of quiet, soft skills can be really hard because contextually, if you think about how much of your time at work is spent in kind of social chit chat with people, but there's kind of a reason behind it, right? Like it's the person who prints everything out for you, and so you really want to maintain that relationship, or it's the person who sets something up for you. And it's also because they're a person that you're really wanting to engage with them, but you're helping kind of socially lubricate your workplace, right? And so knowing how to do that well is really important to make sure that everyone is as satisfied with you as an employee and is wanting to keep you, right? And then also really helping individuals look at careers based on interests, so that we're trying to increase motivation to access and maintain employment by really capitalizing on what people want to do, right? It's a very cool program. It's group-based, and then the social coaches are peers, so it's really, again, supporting that kind of transition into the importance of your social group as you're a young adult. And so instead of having a caregiver or family member involved, it's really somebody who's your own age, who has experience in the workforce, in college, to really help you navigate how to be successful in those domains. And then we are also interfacing with community partners to build internships for these students so that they can actually practice the skills that they're learning within a workplace environment with the feedback of their social coach and our program, to make sure that those skills, any deficits that are happening, we're catching and we're kind of intervening with. So we are currently enrolling UCLA students. So if you know any that might be a good fit, please let us know. What, in terms of, kind of clinically, what are we to do? What are we to tell families to do? How are we to kind of support families as they prepare for their child to, kind of transition into young adulthood? One of the things I would say is prepare early. So as with many things, preparation works better if it's not done 10 minutes prior to the thing happening, right? And so I think one of the things that can be difficult for individuals working with children on the autism spectrum is navigating what the parents' concerns are in the moment, while also planting the seeds of what they should be thinking about in the future, without doing that in a way that is really terrifying, right? Because the goal is never, you need to worry about so many things. The goal is you should feel empowered as your child gets older to know what the next steps are, right? And so I think clinically, that's a really important kind of balance to strike, so that the family is clear what they're going to need to think about in the future, right? One of the other things that I do think is kind of a takeaway of today is that development continues through adulthood, right? And so these individuals may, in their early 20s, not be showing the adaptive skill levels that we would like, but that doesn't mean that later they are not going to continue to develop those skills. And there's actually a lot of research to show that they are continuing to develop adaptive skills. They're continuing to show decreases in ASD symptomatology. And so one of the other things that I try to help my families of young adults know is that this may take time. It's not that it's never going to happen. It just may take more time than we kind of might have hoped, right? So starting in elementary school, I think it's really important to focus on areas of strength as well as weaknesses. Typically, this is a time when resources are pretty heavily involved with this child, and that is fabulous. I think it's really important to be augmenting all of their skills and really supporting their weaknesses, but I also think it's important for them to have fun and do things that they like, because that is part of the role of being a child, and it also really helps us know who they are, right? What do they like? What do they want to do? Because that's going to really help us inform how to support them throughout their life. I also think that it's really important when you are seeing things that are really challenging to intervene. One of the difficult things working clinically is seeing a family who's had a challenge for years and finally decided, like, this is getting to be too much. Certainly you want to let things take a little time and see if they just resolve on their own, but I think we really want to make sure that we're setting our children up for success and allowing social deficits to equal that the child is hiding from everybody at school for 5 years is just, we're losing time that we could be intervening with them, right? And supporting their experience of positive, social experiences, et cetera. In middle school, I think it's really important to make sure that academic goals are really targeting needs and are really kind of building towards increased independence, increased skill, and kind of where you're wanting this child to go. I would really recommend practicing independent skills at home. So again, this is one of those checkpoints for families. How much are you structuring? And if it's needed, what can we do about it? So adding in ABA goals around independence or adaptive skills, adding in occupational therapy goals around that, really making sure that we are building as much independence as possible. And a lot of that is through this kind of modeling of executive function and support of executive function in your child, right? So modeling the home calendar and modeling how we start something and finish it logically, and modeling how we organize ourselves when we get home from school or work so that we don't just have things flying everywhere, but we have kind of a plan. I always talk about executive function skills as kind of like, training wheels or scaffolding that you slowly start pulling away, because the child needs to build those muscles, right? And so you need to kind of flex those muscles for them for a while modeling how you're doing it, so that over time they can do it on their own. And this is a time that's really important for really focusing on that. In high school, I think it's really important. Hopefully, this conversation's been happening forever, right? I mean, we like to talk to our kids about what do you want to be when you grow up, right? So hopefully, we've been talking about who they are, who they want to be, but really making sure that that's clarified so that we can start planning for, well, what is that? Is that realistic? What do we need to do to meet those goals? Are we going to need to kind of modify those goals a little bit because the full goal is unrealistic, but is there something that's near, kind of adjacent to that goal that might be a really nice fit, right? Incorporating new interventions or support can be really important at this point. I think, again, executive function and adaptive skills are really essential. This is definitely the time, while they still live at home, to start pulling those training wheels way back and see what's not working so that you can intervene aggressively in those domains. And then, transitioning to adulthood is a scary process for everybody. So really making sure that emotional coping strategies are strong, are used, that we're not seeing, real upticks in depression or anxiety or any of the other challenges that can go along for anybody thinking about this like wide world out there that has way less structure. And then any employment experience that's possible for your child that's actually been predictive of later employment, and is a really nice way, again, to see in a more controlled environment what works and what are they still needing support around, right? So that then you can be planning for later what are they likely to need to be successful. As a neuropsychologist, obviously, I'm a little biased about the updated testing, but I do really think that one helpful thing to have for families prior to graduating high school is a really good, comprehensive State of the Union of where their child is, because that's really going to help them, if done well, think through all the things that have happened over the life of their child that has gotten them to that point. Is that point where they thought they would be, and then what? Right? And I think that can happen within an educational setting, but it also can happen privately, to really think through, have we met the goals we thought we had? Are new goals appropriate? What are they? Where are we? What's likely to be appropriate expectations for the future, right? And then being really realistic about that. It can be very difficult to realize that you've put a lot of effort into this intervention and you've not made the progress that you hoped you would make. And it is totally fair to sit with that frustration for a while, but you also then need to realistically think, what is going to be the best use of your time, money, effort, etc., as you transition this child into adulthood. So now I want to go through the recommendations that I talk through with families, starting with if cognitive abilities are well below average. And I split them out like that for a couple reasons. One, the recommendations can be very different, but two, access to services can be very different. And so it's just kind of easier for me to think about it this way. So if an individual's cognitive abilities are well below what we would expect for their age, I immediately start thinking legally what needs to happen for this individual to stay safe and to have the supports that they need. And so I am not a lawyer, and I am very quick to say that to families. Obviously, I'm not a lawyer, right? But there are great places to consult to learn more about things like limited conservatorship or other legal supports that might be available to the family to make sure that the child has what they need. There also, it's really neat when you think about the different services that are available. You just have to kind of look for them. The Legal Aid Foundation of Los Angeles has some incredible services that are free to families. Local courthouses often will offer like workshops where they'll walk through the limited conservatorship process. If families bring all their paperwork, they can just complete it that day. There's some really neat services out there. It's just a matter of knowing where they are, right? Financially, if your child is struggling cognitively or is well below functioning level for age, there's a lot of things that you're going to want to think about to make sure that they are safe for the rest of their life, right? And obviously, depending on the functioning level and the socioeconomic status of the family, these can vary widely, but some of the things that are available are a specific type of savings account, the ABLE account, which again, I'm not by any means a money expert, but it's a specific type of account that protects money in a certain way so as not to impact things like Social Security and disability, so that your child can have some financial buffer but not lose their benefits, right? And it's something that multiple people can pay into to kind of help support the individual. Federal disability is another thing that might be really good to look into, as well as if the family is able to, something like a family trust. Sometimes college was saved for, and then it's kind of clear college might not be the best fit or the best use of that money, and so that money can maybe go towards other things. And then thinking about housing, right? So long term, who's this individual going to live with? Who is going to financially support them? There's long wait lists for more public housing options, so getting on wait lists if you feel like that might be a good fit. Just being very mindful of the resources that are going to need to go towards this individual to support them throughout their life. So medically, this goes for everybody, right? But you really want providers with experience. And so again, this kind of bridging into the adult world, finding individual providers who know about autism spectrum disorder, who have experience with severe behavioral challenges or a lot of restricted and repetitive behaviors, or minimally verbal individuals, whatever it is that you're needing, it's really great to look for providers with experience. Now, obviously, that may not be possible. And so then you kind of move to educating your providers, right? And helping them become the best provider they can for your child. And at all ages, I think the experience of parents often is that you are the advocate. You are going to be the strongest, knowledge and resource for your child. And so really helping your providers know how to work with your child is essential, right? To make sure that they're very well cared for. Individuals can qualify for Medicaid, which allows them to maintain insurance coverage. This can happen regardless of family financial status, and that means that then you don't have to worry about insurance, which in the changing insurance market is really essential, right? To make sure that you're not paying thousands maybe every month for insurance, and the copays may be very high, et cetera. I also often will recommend ABA, so Applied Behavioral Analysis, to really work on these practical, pragmatic, adaptive skills to build as much independence as possible. So in terms of employment, the Department of Rehabilitation is a pretty incredible department of the government that supports vocational training, vocational placement. It pays for and coordinates transportation, and it can pay for education that leads to job readiness, right? They're an incredible resource, and they're a government organization, so there's hoops to jump through, but I think they can be a really incredible resource to help kids get out and do things with their day so they feel like they're kind of engaged in their community. The Regional Center is a California series of entities that are designed to provide support for individuals with specific disabilities throughout their life. So one of the really important things is to make sure that individuals apply for Regional Center when they are diagnosed, whether or not they think that they will be utilizing services at that time, because over time those services may become really important, right? And so certainly we find in individuals with greater needs, adult outings, transportation, having a caseworker to help manage all of this, all of that is really helpful. They can also provide conservatorship as needed, and because they are the payer of last resort, they tend to cover adult services because insurance doesn't, right? So with intact cognitive abilities, I would say legally it's more making sure that kids are not getting themselves into pickles. Financially, they're still likely to need some support, and so really making sure that you have any disability services that they qualify for, that there's family trust is needed, or that you set up something like a oh my gosh, the thing we all got, an allowance, to make sure that A, they're practicing managing money, but B, they have some financial support as needed as they work towards greater independence. In terms of employment, the Department of Rehabilitation can be fabulous as well, but again, sometimes their employment opportunities are a little bit more structured or more of the kind of sheltered workshop type. And so one of the things that you can do is think through your social network of who might be a good fit to employ your child. So I've talked to a lot of young adults who were employed by family or a family friend, and that really allowed entree into the working world with a little bit more patience around the challenges they had to kind of get them figured out. And many of them remain employed within that setting because there's a little bit more understanding of their needs and their differences, and so they're much more successful within that. The Department of Rehabilitation can actually vendor with them and help support that employment, as well as just something that the family needs to help work with. Also, what are good job fits, right? So we've kind of been talking about this throughout, but recognizing that somebody that's highly detailed oriented, but takes a really long time, having them be in this like high pressure, go, 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 that's obviously a bad fit. So really making sure that you're thinking through strengths and weaknesses when you're thinking about the jobs that might be a good fit. Very briefly, because this is something that we could talk about for years, right? To disclose or not to disclose whether or not you have autism spectrum disorder, there's a lot of thinking about this. One of the things I think about and talk about practically in kind of a weak economy with families is that if that helps contextualize how this individual is presenting, and that in some way supports the employer in recognizing that they actually do have good skills that would fit, and now they have context for some of the things that felt like maybe they were unsure why it was happening, and that helps them get a job, I think it's something worth thinking about. But that's it's up to the individual. So housing. Again, if you have more intact skills, a lot of times government support programs around things like housing are not as available to you. And so this really becomes, who else do you know that might want to live close by, that might be a good roommate for your child, or should they live at home for another 5 years and kind of see if they're building independence to the point where they might be able to move out at some point. So I think thinking more kind of flexibly as a family, are there ways to kind of create a placement for your child with other people that you know, or friends of theirs from high school, or whatever it is? That's likely to be more common than finding a government program that's really going to support individuals with higher IQ. Medically, you still need experienced providers. I do think that somebody who has expertise in this population is kind of a consultant and support person. If the individual is experiencing increased emotional distress or things like that, can be very helpful. And then I also think really, again, focusing on these adaptive and executive skills is really important, because I see time and time again individuals with superior intellectual functioning who are still kind of brushing their teeth sometimes. And it's like, well, that is not going to be a great marker of independence, right? We need to build those skills as well. So the regional center is more challenging if you have intact cognitive abilities, but it's still worth a try. There are ways, again, this is like another talk about how to qualify for the regional center, but there certainly are ways to help highlight the challenges that higher IQ individuals with autism spectrum disorder experience, to help the regional center recognize that just because IQ is intact does not mean that they would not benefit significantly and really need those services. Something I'm happy to talk about more offline as well. And then, as I said before, independence keeps developing. So one of the things that I think is important to know is, just like today I heard that they're trying to move adolescents from 13 to whatever it was, 18 to like 10 to 24. They're just kind of broadening adolescence out. I know, right? We talk about executive function. It develops, we used to say in teenagehood, and then it was like, well, kind of mid-20s, and pretty soon it'll be like, well, like 45, your prefrontal is still developing, right? So we're just kind of pushing adolescence longer. But I think, that kind of reflects our normative culture in some ways, and I think it definitely fits within the autism spectrum disorder. Neurodevelopmental disorder means that there may be delay in development, but that doesn't mean that development isn't happening. It's just happening at a slower rate. And so, one of the, kind of findings that was in reviewing for this that was seen is that the 20s seemed like a pretty rough period, but over time, it does seem like things can start to pick up. And so our goal is bridge that gap so it isn't so rough, but also recognize that what we're doing is kind of continuing to build on these skills so that over time they can happen more fluidly or more independently, right? And then, as I kind of mentioned before, rethink the markers of success, right? So, I think we certainly talk a lot to young adults with autism spectrum disorder, both clinically and in research, to try to understand their lived experience. But I think that that's a really essential component of what do they want, right? What does anybody want? That's a really important clinical aim, right? We need to know what they're actually working towards. And I know a lot of young men that really don't want to live on their own and work full time because it is very boring and it is stressful to have to pay bills and clean up after yourself, which it is, right? And so I think certainly we do not want to kind of promote, great, well, live in the basement forever, if that's not something that is going to lead to happiness. There are many different ways to help build as much independence and as much engagement in the community as possible, but recognizing that this full-time job, living on their own, paying all of their own bills, may not be the only metric of success. And so there's other more flexible ways to think through how to support these individuals. Okay, so take-home message I've kind of hit along the way. There's a lot of variability, and so one of the challenges in thinking about transition is that these structured programs that are available may not fit everyone, and there isn't this kind of broader structure of if this, then here's this path, or if that, then here's this other path. It's really that you're going to have to kind of help families make their path. Sometimes it will be easier because of certain structures. Often those are in place for individuals with lower intellectual functioning. But regardless of that, families need to make their own path. And so really helping them understand the domains to think about, the resources available in the community, and the things that are likely to be the most helpful to their child is likely to be the best path forward until maybe we get policy change that really does provide more structure, which would be great, but not there yet. And then I think when I see clinically young adults that are struggling, this is what they're struggling with. They're struggling with distress tolerance and frustration and lack of motivation to engage in non-preferred activities, and they're struggling with executive function and planning and organizing, and they have all these grand plans and zero of them get done because they just, that initial do it step is really hard for them. And so hitting those domains as well is really helping support ASD symptomatology. I think that those are really essential domains for intervention throughout the lifespan, but certainly as we're thinking about this transition, because those are the soft skills that we are all having to rely on to successfully navigate into adulthood, and they're clearly areas of challenge for these young adults. So, not Christmas anymore, but close. Thank you guys for your time. Thoughts? Questions, comments?
We have about 5 minutes for questions.
It's more of a comment question, but I think recently I heard about just thinking of support services for this transitioning youth. Is it Department of Rehab, someone may know, is now providing housing stipends for individuals who are willing to live with young adults?
Oh, that's awesome.
So I have to get the information,
Yeah.
but it was something new that actually a parent had alerted me to. And it may be, again, just another resource for,
Totally.
Ways to get individuals a little more independent out of the home, but still being kind of provided for, or at least having some sort of
structure.
Yeah.
Yeah, absolutely.
I don't know about the housing.
Yeah,
piece of it.
yeah.
I don't reveal one, I've not heard anything, but I did
Okay.
want to make people aware that in high school, the Department of Rehabilitation provides pre-employment transition services. And that is not specific to a disability group. So that if you do have a family member who has a high schooler, they should be asking for these pre-employment services. And they are free. They do career exploration. they spend time talking about the student's interests, give them opportunities perhaps to job shadow or, actually kind of look into different careers. So that's an important resource to
Yeah.
have in mind.
Anyone else? Yeah.
I think one component that's really essential for a lot of these young adults who've already gone through the elementary school, middle school, and high school sequence, and then are not able to go to college, but want to eventually be independent, is that they lack a sense of community. And I think that you can really, if you provide some kind of program, like perhaps what you're doing with the college to career transition program, if you provide some kind of community for them, at the same time you're teaching them the skills, then there's a motivational factor that is encouraged as they learn to become more successful and have this community around them that's supportive.
Yeah, no, absolutely. I mean, I think that it takes a village is very applicable, right, for all of us, but certainly in that young adult phase, if you think kind of normatively about development, your peer group becomes a really essential community in young adulthood, and so fostering that is likely to be very fulfilling, but also really helping keep motivation up. That's a great point.
And I'll just kind of add to that,
Yeah.
that in my experience, I'm a parent, that it's moderate to higher functioning young adults who have a really hard time fitting in because the systems of care are set up so that, like you mentioned, a lot of it is geared to the most impacted.
Yep.
And there aren't, regional center will tell you, you have to go to your community. If you take your kid to the community and they don't want them, you
Right.
can need support.
Right.
And so the family ends up being that coach
Yep.
in that environment
Yep.
and really doesn't allow that young adult to explore who they
Right.
are and develop friendships.
Yep.
And they also become very
on their own.
isolated as well.
Yeah, absolutely. It's a very difficult thing to say, oh, your child has such wonderful skills. That's going to be hard. You know what I mean? But it is true that at the lower end of the functioning spectrum, there is more structured support. And so I think one of our goals with College to Career and just, kind of in general in this transition work is recognizing, okay, so how do we replicate that for higher functioning individuals? And by higher functioning, that can mean a lot of different things, but individuals who are able to navigate the world more independently or ought to be able to, right? Because it is really hard and it's really frustrating for families, I think, to kind of feel like things were going very well and then the kind of structure of school stops and suddenly it's like, whoa, this is really hard.
And by that time, the self-esteem of the
Yeah.
kid, this teenager has just taken a dip.
Totally.
And so they're afraid to
Yep.
venture out.
Yep.
And so it
Yeah.
just becomes challenging.
No, you're absolutely right. That's part of our fight, for sure. For sure. Yeah.
How long is the College to Career program?
Sorry?
How long is the college?
How long is it? What is it? 6
How many years, or is it?
We actually are just piloting a one-year program
Yeah.
right now, and it's on a quarter system. So the first quarter, we're training career coaches, which are undergraduate students here at UCLA. And the second quarter, we're training the young adults on the spectrum with the help of their career coaches. And then the third quarter, we'll be doing internships or externships, again, with the support of the career coaches. And that the format is not just 10-week intervals, but also they meet twice a week for an hour and a half each week. So it's kind of like a 3-unit class. We sort of set it up for the equivalent of that. So they spend 3 hours at least in sessions of instruction. And we have information about that in the back of the room.
Yes. Excellent. All right.
I think
Are
we're
we
out
up?
of
Yep.
time, but I think you'd be happy to stick around if you have
Yeah, absolutely.
questions.
Thank you guys. Thank you all for coming.